tonight we are incredibly lucky to have the fantastic vet physio, Diane Messum, with us. And she's going to be talking about mechanics of movement and harnesses and a few other aids. We've got hopefully, if technology wants to play ball, a presentation to show you, which will be really cool with some pictures and videos. And we're just trying to give some advice really on harnesses. So Diane, please, could you tell a little bit about yourself?
Thank you, Esme. Hi, CAM followers. I'm delighted to join you all again today, and yes, hopefully bringing to you some exciting stuff and things to think about. But I guess Esme wanted me to introduce myself and my background. I work at Davies Veterinary Specialists, but it's been a long way to get there. So I qualified initially as a human physiotherapist back in 2002. And worked in the NHS and private healthcare for 12 years in total. And I started my master's degree in 2005, finishing that in 2007 at the Royal Veterinary College. So I've been practicing on animals since 2007, and then went to Davies. I took a position there in 2011 and set up the therapy services there, where we're continuing to grow. And we also work together with the anaesthetist to deliver part of the pain management team as well that we have there. So it's purely small animals, so cats and dogs, and yeah, it's fab place to work. And I'm very fortunate to have a great team around me of orthopedic surgeons, neurologists, amongst many other specialities as well. So yes, and yeah.
It's brilliant. You get to see that, the multimodal approach that we always talk about on CAM, having a great team together all to get stuck into a case and, you know, give that patient the best possible care, which is amazing to have that kind of service for our clients, isn't it? So, yeah, brilliant. So, well, should we get started?
Okay, we're going to try and go to a presentation. So bear with us while we'll just transfer. Hopefully this will work.
And I'm going to disappear for a little bit.
So are we there, Esme? Can you confirm?
Just coming live now, Diane. There we go.
Great. So fingers crossed. I can only see my presentation in front of me, so apologies, I can't see any questions as we go along. So Esme, if there's anything that pops up, just interrupt any time, so I don't mind taking questions as we go along.
Brilliant.
So we're going to leap into why might we choose a harness over a collar, I think was the first question that I wanted to raise, and is probably on everybody's mind. And I think there's a lot of interest around what collars can do, particularly for those dogs that pull on them. Collars are believed to exacerbate eye problems, eye prolapses in particularly the brachycephalic breeds, cause intraocular eye pressure, can cause collapse of the trachea or laryngeal paralysis, or it can exacerbate those problems. Obviously, if you've got a dog that's got cervical problems, neurological issues arising from the cervical spine as well, it's not something we would recommend. It can put pressure on the other sensitive structures as well, like the lymph nodes, the mandibular gland and the thyroid gland in the neck, and have a negative effect on the lymph system overall. And it can affect the blood flow and neural pathways as well in the neck, as we've already touched upon with the cervical spine there. So all in all, you know, if you've got a dog that pulls a lot on the collar, then a harness might be something you would consider. It's considered a safer option, I would say. And yeah, so that's why we might consider a harness.
Diane, you said the word brachycephalic. Could you just explain what that means?
So breeds a bit like pugs or French bulldogs, where they've got a shorter airway, so they aren't, you know, they have, you know, they can have difficulty in breathing and taking in oxygen. So those types of breeds are probably more vulnerable to issues if they pull a lot in the collar. So we often recommend harnesses for that particular breed anyway, if you've got a dog that does pull. Obviously, for those that aren't pullers and they're trained not to pull on a leash, then then a collar and lead may be fine, but something worth considering as well.
Absolutely.
Okay, so the next slide that hopefully you've got up, it shows the skeleton and the musculoskeletal system of the dog. We've got two circles hopefully on your left, white circles that are just showing the glenohumeral joint, or otherwise known as the shoulder joint. And then you've got the scapula, which is the shoulder blade, which is that the larger bone, which is the highest in the forelimb. And you can see the spine that runs down that. So we call that the spine of the scapula. And that's articulating. So it's adjoining to the thorax, which is it's basically attached. So the forelimb is attached to the thorax with just purely soft tissues. There's no joint. We call it that the scapulothoracic junction. So those are the two main areas we might be concerned about when we're looking at harness design. And we'll come on to harness design shortly. I think the other image that you've got there is the musculoskeletal system, and there's two structures I've pointed out which are visible, and there's a third one that isn't there. And I think a lot of people are concerned about harness design and the effect on supraspinatus, biceps brachii, and infraspinatus as well, three muscular structures around the glenohumeral joint, and causing tendinopathies. But again, we'll touch upon that in a later slide. I think, you need to have good body mechanics in a dog, and in order to have good movement, you need all these things like, the muscles, bones, and joints to all come together to aid proper alignment and good movement. And so if you're fitting a harness and restricting that movement, then, your dog is compensating and changing the way that they move as a result of that. So I hope that makes sense.
Absolutely.
Okay, so this is just really, I hope, just a simple introduction to the shoulder. And if I just go back to the earlier slide, you can see the direction we're facing at the moment. So hopefully where you're looking at the screen, the dog is pointing to the right. And so this is the shoulder joint, and this is the right shoulder. So dog's head is pointing to the right, imagine that. So I've circled the soft tissue structures we just briefly touched upon, supraspinatus, infraspinatus, and the biceps brachii tendon. And those are the structures that a lot of people are concerned about with some of these harness designs. So, a lot of working and competition dogs already, might be wearing harnesses purely because of the work they need to do. But they're also at higher risk of injuries as well to the shoulder through repetitive movements. And I think overuse injuries also come into play when tendons and ligaments are affected by this. So you get tendinopathies arising in supraspinatus, your biceps brachii tendon, and your infraspinatus. So I think obviously working and performance dogs are more vulnerable to those injuries, and also there is another injury called medial glenohumeral joint instability, which is when the ligaments that you can see on this image can be compromised as well. But overall, I think it's not known whether, if they are wearing harnesses, whether they're also playing a part in these increased risk of injuries in this caseload. So there isn't just the research out there to be able to know any more really than what we already do. And I'm going to talk about the research that is out there, the limited research, and maybe it's something we need to be looking at for the future, so we know which harness designs are better for our pets. Okay, so some fun videos now. Hopefully that's working. Esme, can you confirm?
Yes, that's perfect.
Great. So this is a fabulous video, which is part of a study that was done by Martin Fisher. And he has a book called Dogs in Motion, which if you're interested in dogs' movement and different breeds and how they move, he has a fantastic book. I don't know whether if you can see me in the bottom corner, that's what it looks like, Dogs in Motion. And it comes with a fantastic video as well, or video, I say, a DVD in the back of it.
You can tag in the comments afterwards, Diane.
Sorry?
Well, I'm happy to tag the link to that in the comments at the end.
Perfect. So yes, I can pass that information on. But I'm just going to play that once more because I seem to she says. Wobbled on through that. So during this video clip, you can see how much movement occurs through the shoulder, the glenohumeral joint, and the scapulothoracic region as well. So that's just highlighted in red there, the scapula, and we talked about that earlier and how that articulates with the thorax. And then the glenohumeral joint is just at the bottom of that red bone, or orange bone, should I say. And this is the canter gait, so we can see how the movement changes. And then they're starting to add layers of muscles on. And you can see when they're contracting and relaxing as well. So I just thought this is fantastic to start getting us thinking about what movement takes place in dogs without any, external help from harnesses or collars. And then this leads us on to our next slide, which bear with me while I just move on to the next slide. Because this is also a video, and I'm not going to play this right the way through, but this just shows a few different breeds and how they can all move differently. So I think what one harness might suit one breed may be very different for another breed. And I think Esme and I have spoken before about the difficulty in fitting a harness to her dachshund. So, yeah, you know,
he's still, I haven't got, health issues with him. It's just his body shape's so awkward. If I find one that has straps far enough back that it doesn't rub the back of his elbow, then it can be too tight around his chest and then rub the skin on the front of his chest. And because I do, surprisingly, he does quite a lot of exercise. He's quite good at running, which I know he's got no legs, so he shouldn't be, but he enjoys a little bit of a jog. And then I have to be quite careful that I don't, he will just run through it and I'll get home and find he's got sore skin. So I find it quite tricky. So I'm excited to learn more about harnesses today from a selfish point of view.
Well, hopefully you can take home some tips on what to look for. So I'm just going to see if I can move on to the next slide, because I think you've all had a taste of that.
It's amazing watching all those different breeds, because there is such a big change in movement between them, isn't it?
It is, yeah, very different, because obviously you'll see a video that's coming up shortly that I did with my little dog, and his movement is very different to your larger breed dog, and it'll make sense when you see it.
Yeah.
Now, I was in two minds whether to add this slide in, and I think there's not much been spoken about it in the small animal rehab world, but obviously my human background, as part of my training and an early working career, I undertook a rotation in neurology and treating a lot of spinal patients and stroke patients. And one of the concepts and principles that we used to apply was called the Bobath principle, or Bobath concept. And that's a physiotherapy treatment, which is designed to improve movement and mobility in patients usually with central nervous system injuries and problems. So I'm treating a lot of neurological cases in my practice as well. I see an awful lot of them. And one of the biggest things I suppose I tell owners when they go home is to, I normally recommend that they consider purchasing a harness, because I think you can do so much through a harness, not just for your normal walks, but for part of your rehabilitation. And just bear with me while I touch upon the points that I wanted to make. So I think the principles of the Bobath concept, going back to that, is that we're looking to encourage normal movement patterns. We're looking to improve the quality of the movement, because a lot of our cases that are following neurological injury and trauma and had, maybe have had spinal surgery or they're being treated conservatively, we're looking at restoring as close to a good quality movement as possible. We're looking to try and normalise tone and to facilitate active movement through that as well. So changing levels of tone, and tone means, You can have low tone and high tone. So low tone is when your muscle is more flaccid than normal, more floppier than normal. I'm sure there's a better term for it out there. A normal resting tone, like we would all have, is a normal level of tone. And then you can get high tone, where you get overactivity in the muscles. So it means movement is very difficult. And obviously, from a physio point of view, that's quite hard when we're trying to facilitate and normalize muscle tone. But luckily, we don't see loads of those cases. We also want to look at improving positioning and posture, discourage compensatory movements. And we're trying to promote maximal functional recovery to improve the quality of their independence. So those are all the concepts, that we're working with here as part of the boat bath principle. And on this image here, you can see there's a person to the left, which I found, and it shows three things. It shows the CKP, which is the central key point, and then you've got your proximal key points, which are your triangles, and then your distal key points. And these key points of control, these are called key points of control, the parts of the body where the therapist or the hand effectively control and change patterns of posture and movement. So I've reconfigured that and drawn up the dog, which is on the right side of that slide. And basically the key point of control would be around the sternum and the nubrium of the dog, or the sternum really, essentially, is probably the best word to use. And so if you imagine where your harness is sitting, if it comes down between the forelimbs, you're going to potentially have a little bit of influence over their overall posture. If you're taking up a gentle pull through your leash, if they're attached to the leash, then you can perhaps facilitate the position of their body. So for those dogs that are weak in those hind limbs, we do see them transfer their weight forwards quite a lot. So you'll see their forelimbs will come more underneath their body as they transfer their weight forward. And they start to use their abdominal muscles a little bit more because they're weak in their hind limbs. And we also see that in our dogs with hip osteoarthritis as well. They're compensating. So I think if you're getting, if you're seeing this and your therapist has advised you this is what's happening as well, you could potentially use your harness to try and facilitate better movement or better weight transfer, or encourage the weight transfer that's more desirable, to get them to engage their hind limbs a little bit more by just doing a little check through the leash rein or leash that's attached to the harness, and applying a gentle pressure through that central key point, which is around the sternum. Does that make sense, Esme?
Yeah, that's absolutely perfect. Just to clarify a couple of words you've said, just so that people who aren't Betty understand. You just said about proximal and distal key points. I just wondered if you could just explain what proximal and distal mean.
Of course, no, sorry, apologies. So the proximal means the joint which is closest to the vertebral column. So we classify all the joints away from our spine as peripheral joints, and we can have proximal joints and distal joints. So we use proximal as anything being closest to the spine, and distal being something furthest away from the spine or vertebral column. Yeah. So the proximal key point is around the shoulders, as you can see, and the distal key points are around the hands or the paw, if it was the case in dogs. Does that make sense?
Absolutely, it's brilliant.
I think I'm probably, for the purpose of this talk, I'm talking mainly about the central key point, mainly, but I think it's something we could consider as rehab therapists about how we use, proximal key points and distal key points as well. Yeah, but anyway, so slight tangent there, but hopefully you'll find that interesting. Before we start talking about different harness designs, I just wanted to say we're going to be discussing a lot that are closely associated with certain brands, and we're going to be classifying them into certain categories: wire harnesses, breastplate harnesses, and assistive harnesses. For the purpose of the discussion, we're discussing the effect of each design on the dog's form and function. So I'm not advocating or recommending a particular brand of harness. So I just wanted to raise that point, if I may. So this is the first Y harness that I wanted to bring up, and this is a great harness. It's I think this is probably one of the harnesses that are as close to a bespoke harness that you can get. What this harness delivers is it allows you to choose different sizes. So basically it's a harness that comes in 3 different parts. And so your pet might be a small in the top part, it might have a medium Y front and then a small girth if it's particularly deep chested, or, you know, there may be multiple combinations of things. So this is a good harness for getting something that's as good a fit as possible, I would say. What's nice about it as well is that it has clips which connect the front Y portion to the top portion. So it means that you don't have to take the harness over the dog's head. So if they are a bit worried and they don't like anything going over the head, then you've got that as well. So once it's fitted correctly and you've adjusted your harness accordingly, you don't need to worry about extending loops to get it over the head. You know, you can just unclip it and remove it or apply it easily and reclip. So that's what's nice about it. It has got 5 adjustable parts overall, so it can, you know, like I said, you can get it as good a fit as possible. And each of these harness designs have different manufacturers' recommendations regarding fit, so it's worth following up. A lot of them might put fitting instructions or advice on YouTube, for example, so do follow up on those because it's really important if you want your harness to fit as well as possible. I think overall, as a general rule, though, you're looking for 2 fingers to fit, you know, between the harness and your dog, all round if possible, for it to be a good snug fit. Okay. I think this one's also a good one that can be considered for amputee cases as well. But yeah, so I think that's all I wanted to say on that one. Another Y-type harness, again, when we're looking at this as well, we're looking at so the image with the pink harness on shows the forelimb quite clearly, and we can look at how it is enveloping the forelimb. It's not showing any signs of restricting movement from that image. You've got nice freedom of movement to be able to occur through that forelimb. This harness differs to the previous one in that it comes as one piece, and so you've got just 2 clips to fix it in place. It goes over the head, so for those dogs that aren't comfortable having something fitted over their head, then obviously that's something to consider here. Again, these harnesses can be considered for amputee cases, and there's some further modifications for different brands within this company as well. Sorry, did you say something, Esme?
No, nothing. I'm just listening, fascinated.
But what you'll notice as well, which was also on the previous one, I'm afraid I didn't point out, is that there's a clip on the top towards the rear of the saddle part of the harness, and then there's also a loop on the front, which you can also see that the leash is attached to on the dog in the bottom image there as well. So having those anchor points is something you want to bear in mind as well. So obviously the one on the top is the most common anchor point, but some dogs often will pull more when they have an anchor point towards the rear of the harness like that. Although I prefer the anchor point to be in that position rather than at the front of the harness, when you're more likely to take up too much pull towards the front of the Y portion and potentially restrict the trachea if it's fitting a little bit higher up, if that makes sense. So considering where your anchor points are is really important. So you've got your loop in the saddle portion and then the loop at the front. Now, the way that is used is it can be used to clip an additional lead, so doing your 2-point lead system, and can be used for guiding your pet in certain directions. But also, if you do have a pet that pulls, a dog that pulls on the harness, you have your primary anchor point on the saddle portion of the harness, but then you have your second clip and line attached to the front. And what you can do is apply a gentle squeeze to essentially not knock them off balance, but check them and challenge their center of balance, essentially. And that's discouraging them from pulling forwards into the harness. And so that's part of the training. And I don't confess to be a trainer. It's worth consulting a professional dog trainer, but that's my understanding anyway of it. I think the other points that I had, just trying to think, so yes, the other point I had to make here is that alternative methods for slowing a dog down and stopping them from pulling have been considered, with the use of the figure of 8 lead that you might see that people pop over their pet's muzzle, and also, a standard head collar. But if you imagine you're taking up a pull and checking the leash that's attached to the head collar or the figure of 8 lead, you're potentially looking at excess side flexion through the neck and compromising neck structures if you're having to do it quite regularly and frequently. Does that make sense?
Yeah, absolutely. My sister had a husky Malamute breed, and he was a big puller. And stupidly, she went and had a couple of sessions on like husky sledge, training, and then found it really hard to take him for a normal walk because he really loved the pulling side of things. And a harness like this with the 2 leads and the loop at the front made it so much easier, because then when he really did pull it, and he was a big dog, he wasn't pulling her into bushes, he was just turning himself, so it wasn't damaging him, it wasn't damaging her, and then he quickly learned, and he grew out of that very quickly. But I think she enjoyed the training session but then regretted it afterwards.
It's always nice to do something different, but yeah, we have to consider the consequences.
Yeah, absolutely.
So as you can see on this one, there's 2 loops again, so one towards the top on the blue portion, and then you've got the D ring as well on the front Y portion there as well. Okay, so and then we come to our breast strap harnesses as well. So this is probably, as I said in the beginning, we're talking about 2 groups mainly. We'll touch upon assistive harnesses in a little while, but this is the breast strap harness. So this, as it describes, has a breast strap coming across the front of the shoulders, essentially. So I think there is some concern that it's going to restrict movement of the front limb, although they believe that the material that sits over the front of the shoulder, as the dog extends its gait and transitions into a canter, when they get a lengthened stride and their forelimb is extending further, it's understood that fixed portion should glide up above the glenohumeral joint, or shoulder joint as we would call it. I guess I have some reservations about that, in how much repetition of glide you're going to get there and whether that's comfortable for the dog. But we're going to talk about the research that's been done, look at the different types of harnesses as well, and it's quite interesting actually when we look at that research. So that's one of your breast strap harnesses. I think that's everything I was going to say on that one. And then just a different style as well. Again, it's got 2 clip points or anchor points. So you've got the ring on the top of that harness, and then you've got your rings at the front as well. So you can have your 2-point control system also for using this harness. And again, if you look where that strap comes across the front of the chest and shoulders, we need to consider how it's fitting and whether that's affecting your pet's movement, essentially. Okay. So this is a fun little video. So this is my little dog, Watson. He's not your typical medium or large size breed, but what I wanted to find out when I did this last Friday was to see how his gait changed with different harnesses. So obviously this is going to keep going on a loop while I carry on talking, so hopefully you'll get to see and analyze it well. But you can see overall his movement hasn't changed a lot at the walk. Now, I was doing this on my own and I didn't have any assistance, just because of obviously the measures that are taking place at the moment. But I would probably like to consider doing that again at trot. I'm not sure I feel brave enough to run him on a treadmill, so we might not look at a canter gait. But I've got another video which is quite interesting shortly. So I guess that leads me on to talk about, whilst this keeps running on its loop, is to talk about the research that's been done currently, looking at restrictive harnesses and non-restrictive harnesses. Now, I just want to clarify what restrictive harnesses are usually, what they mean, and what non-restrictive harnesses mean. Now, Restrictive harnesses are classified as your breast strap harnesses. So essentially those that come across the front of the shoulder joint or sit just below the shoulder joint, essentially. So those are all classified as breast strap harnesses. And then you've got your non-restrictive, which are your Y-shaped harnesses. And that's what the two studies that I managed to find refer to. So there's one study that was published in 2018, done by, I believe, the Royal Veterinary College. And they took 9 dogs and they examined 3 different types of harnesses. So they looked at 3 harnesses, 2 of which were non-restrictive and 1 which was restrictive. And they put markers on the forelimb and they looked at measuring shoulder angle in maximum extension whilst the dog was walking and trotting. And what they found is that obviously when the dog was wearing the collar and not pulling, there was greater shoulder extension at walk and trot than there was with any harness in situ. And then what they found with the 2 different types of harnesses was that actually there was greater shoulder extension in the restrictive harness than the non-restrictive harness. So not really supporting the original hypothesis. They were anticipating that there would be less shoulder extension in the restrictive harness in comparison to the non-restrictive harness. So that was quite interesting. And we'll talk about the limitations of the study and why those results might have arisen. But also they tried to simulate pulling on the harness by adding weights as well. And so they try to add weights, simulate that by placing them, I think they lifted them away from the dog and at a 45-degree angle to the dog to try and simulate that. And the results are very similar. So actually there was greater shoulder extension with the restrictive harness than there was in the non-restrictive harness. So yes, that was quite an interesting study, and obviously, you know, something we need to bear in mind. And I think that's one study with a small number of dogs. We need to, you know, be looking at expanding upon that. And what they did recognise is that they didn't measure stride length or step length, which I think are really important factors to consider. And yeah, so I think that study obviously is something that is really helpful and a good starting point, but we need more. So there was another study as well, which I couldn't see was published, but was an abstract that was delivered at the American College of Veterinary Surgeons back in 2016, and it was done by Carr et al. And they looked at non-restrictive and restrictive harnesses again. They took 10 dogs and they looked at 5 harnesses on those 10 dogs, and they measured gait kinetics. So they placed them on a pressure mat essentially, and they assessed the dogs at trot. And they were looking at, so what they found is that they were looking at stride length, they looked at step length, and they looked at the total pressure index, which is the amount of pressure that goes through the forelimbs. And they made it very clear that those dogs could not be pulling on the leash when they were fitted with a harness as well as part of this study, because it would just skew all the results. And actually they found there was no significant difference between those 2 harnesses. So again, perhaps this breast harness isn't, you know, having the effect that we perhaps might think it does. So I think it's worth considering, but as I said, this is just the only 2 studies we have out there, and there's lots more work that needs to be done, and looking at the methodology and seeing whether we can change that and challenge, you know, challenge our theories a little bit further, essentially. So is there any questions regarding those 2 studies, Esme?
There's no questions about that. I think it's interesting to know, well, one that I assumed, maybe a bit naively, I just assumed that there would be loads and loads of studies out there. That's very naive of me, but I just thought there would be. And also I think it's interesting when you look at these studies, you know, we have to look at them critically, and we've got a population of, one of them was 9 dogs, so it's not a huge population. It's not representing all dog breeds and all dog types. And then we've obviously, a lot of people who are watching this platform are going to have dogs who struggle with walking. So that's a whole new thing, not just a healthy dog, but a dog who hasn't got good health in the way they move and how it affects that as well. So I think, like you said, there's so much work that is exciting that could be done. It's just getting it done, I guess, isn't it?
It's having the funding for this type of research as well. And there's so many more important, illnesses, pathologies that our dogs, our pets have, that the research is being ploughed into, research funding is being ploughed into. So, unless we, have the funding for these types of research projects, they're just not getting done, unfortunately.
Yeah.
I think going back to the original study, there was concern when you looked at the pictures that the non-restrictive harness, so the Y-shaped harness, the portion that came around the front part of the shoulder blade, like it was digging in slightly. So if you remember the video of the dog moving and you saw the amount of scapulothoracic movement that occurred in the forelimb, what may have been happening is that that was being restricted by the positioning of the Y-shaped harness. So I think that was one reason that they felt that they didn't see the shoulder extension that they had anticipated.
Yeah, interesting.
So I think fit is really important. And actually another point that was made by an American colleague regarding that study was that when you're fitting these Y-shaped harnesses, they do need to be very snug around the neck. And ideally, to ensure that snugness, having the ones that clip around the side that you can remove more easily would be more desirable than an over-the-head style where you've got to have a wider neck hole, if that makes sense.
Yeah.
Perhaps they are sitting a bit too deeply into the neck and potentially having that little bit of restriction. All right. Anyway, you've probably seen enough of Watson. Let's move on to the next one. So this is just a slide showing the different type of harnesses that he's wearing. So the middle harness was actually part of one of the assistive devices, which we're going to touch upon in a minute. So, but it's still nevertheless Y-shaped in the front portion. Okay. So I'm just going to knock off the sound. I'm sorry, I thought I'd done that, but there we go. So this is Billy, who's one of our therapy team dogs. So he's owned by our head of anaesthesia. And so I know we're not going to spend a lot of time talking about working dog harnesses and service dog harnesses, but 18 months ago we were asked to assess this harness that was being trialled at our local police dog force, to look at protection for their dogs. That was following quite a well-known case that had happened. It was in the news and media, which was Finn, who was treated at our practice. So the Finn's Law, people may have heard Finn's Law was passed to try and protect our police dogs. And so they're looking at how they could, how we can protect them with this type of harness. And this is from New Zealand, this harness. So it's stab proof and it's got, sort of protective elements through the main portion of it. So I did draw up quite a comprehensive report, but Billy here, you can see in the slow motion, and it does extend quite far back over his spine, but you can see in his run, he's quite limited in his run, and that's made more obvious in this clip here, where you can see how much flexion extension through the thoracic and lumbar spine he has, and the extension through his forelimbs as well. Yeah. So, so I think when we're looking at harnesses, looking at how far the saddle portion comes back over the spine is really important as well. And looking at the effect on the thoracolumbar movement needs to be considered. But hopefully many of our dogs don't require anything as robust as this. But I just felt it was worthy talking about. And I guess that leads me on to another study that was actually only published in March of this year. And that was a study that was published in the American Journal of Veterinary Research. And they looked at service dog harnesses, two types of harnesses, one not too dissimilar to this, and another one that had less coverage underneath the trunk. And they took 5 dogs, if I'm correct in saying that, 5 client-owned dogs that had no orthopedic or neurological problems. They were between 20 and 30 kilograms of weight, and they were aged 1 to 4. And what they wanted to do was look at the effect of these harnesses on the thoracolumbar kinematics, so the spinal movement essentially. And it goes without surprise that obviously there was quite a lot of restriction with this type of harness. And I think with that, if you've got a dog that is restricted through the thoracolumbar spine, we have to really analyse the effect on the rest of the body, because that dog is going to need to compensate through that loss of range through something else, especially if he's motivated and he's after a suspect, or, you know, he's in a life or death situation. They need to get out of there pretty quickly. So challenging and placing more pressure on the rest of the joints is going to, you know, be a problem for these cases. So especially if they're wearing these harnesses for quite long periods of time. So hopefully that has sort of given us some further food for thought. Is there any questions on that at all?
Well, I think it's just absolutely fascinating, isn't it? And I think everyone in the general public would like to thank Davies for saving Finn and all the amazing work you did around that. It's incredible. And I think, you know, in general, we're talking about poorly dogs in this scenario, and we're asking questions about harnesses, but it's really nice to see other uses for harnesses as well. And it's not something that you'd necessarily think about when, you know, I don't often deal with service dogs. So for me, it's fascinating to hear about these studies and to see them in action. And I guess the compromise you've got to make between that dog's safety and speed and long-term compensatory mechanisms as well. So fascinating.
Absolutely. So that then leads us on to the assistive harnesses, and I think this is one that's on the CAM website, and this is the Help 'em Up harness. So it comes in 2 portions, and we use these every day at work. We find it a brilliant harness for our needs, particularly anyway, and not just the osteoarthritic pet, but we use it probably mainly for our neurological cases. You know, I'll be honest, we use these an awful lot to assist us in mobilizing our patients and getting them moving again following spinal surgery or conservative management. So the 2 portions are, you have your forelimb portion, or thoracic limb portion as we might refer to it as, and then you have your hind limb portion, or your pelvic limb portion, otherwise known as, or it can be referred to as the hip lift as well. And you can see there's 2 handles on this harness. So, you know, if you've got a dog with severe elbow osteoarthritis, having the handle in the forelimb will allow us to help our dogs, especially if they have to negotiate steps or stairs and you want to take and reduce some of the forces through those osteoarthritic joints. You can take some of the forces away through assisting them through that handle. And the same goes for the hind limb as well. So, you know, that they might be becoming weak in those hind limbs because of hip osteoarthritis or stifle knee osteoarthritis. So you may feel that you need to assist them. And so, you know, overall, this harness is great for helping your dog with their transfers. If you've got a dog that is struggling to get up from the floor and you need to assist it in some way, going up and down stairs, getting into and out of a car via a ramp. I have seen it being used to lift the dog as a whole, and I'm not a fan of that, I'll be honest. I have to say, I don't feel the straps are broad enough, and the breast portion and the part that goes in the pelvic floor isn't, I don't feel substantial enough, and it's going to be quite uncomfortable for any pet that is being asked, you know, to be supported through that way. So that's one point I wanted to make. There's also, you'll see in the image on the right, there is a handle that you can clip onto the harness, and that will go over the shoulder. So, you know, if you have hand problems or musculoskeletal problems yourself, then you can take some of the weight through your shoulder if that's more comfortable. So that's as an option as well, for that harness. So are you confused by too many choices? I think there are so many choices on the market, and I think you have to look at each one and, you know, look at their design and see what is going to work for you and your pet. So we don't have the answers because there's just not the research out there. There's so many different designs available. So I think before we complete this part of the discussion this evening, it's, you know, I think you need to consider whether you want a handle on your harness. So some handles some harnesses have handles attached to them, and also the position of the handles. So if you look at the 3 harnesses along the bottom, you've got 2 either side of the blue one, which have horizontally positioned harnesses, or across the body positioned handles, and then you have the one that lines itself along the back. Now, I would say the one in the middle, I feel that the handle is almost too far back for a lot of our cases. So if you're considering a harness for a dog that has elbow osteoarthritis and you want to assist them through those forelimbs, that's probably not the preferred harness, just because I feel a lot of the force is coming through the trunk, the way it's positioned, rather than taking and offloading the forces through the forelimb. So you're probably looking at a handle that's a little bit further towards the head, if you're considering any assistance for your pet that has falling problems. Okay, so any questions from harnesses? I'm happy to take any questions.
So there's a question about what would be the best harness for lumbosacral disease?
Ooh, good question. So I think with lumbosacral disease, there is a potential that your pet is going to start having hind limb problems and weakness. So you may be wanting to consider something that has a hip lift or a pelvic limb portion. But I think it's really important that you work with a therapist who will assess your pet and your pet's needs, and hopefully look at your pet as a whole, considering, a home management plan in addition to a targeted exercise program to try and prevent any weakness from occurring in those hind limbs, and look at pain and relief of pain, and making your pet as comfortable as possible. So I'd probably say, I would consider that if you're looking for a long-term option. I think if your pet is still walking quite well and had an early diagnosis, let me think. I would say it depends if you feel your pet is going to be a puller. So if your pet's going to pull, they're going to be working hard through their forelimbs. They're going to be offloading their hind limbs a little bit more. And so you're not going to, they're not using the hind limbs where perhaps you might want to use those hind limbs and keep them engaged and keep them strong, as long as it's working within their pain limits and their disease processes, really. I'm sorry, I'm not really giving a very clear answer there, but I would say those are the 2 things that I would be considering. So if they are a puller, then maybe consider one with a clip on the front if you're looking for a simple harness, so you can start looking at training if it's not too late, and train them not to pull, so you can hopefully start to get them more engaged in those hind limbs by checking them and getting them to use those hind limbs a little bit more effectively. So I wouldn't say there's one over another that I would consider. I think I would personally consider talking to a therapist who can assess your pet and your pet's needs to make that final decision.
So this leads me on to this question. Yvette's just asked, would her physiotherapist be able to recommend to us what kind of harness to buy, or depending on the, sorry, it's small writing, depending on the dog's issues. So she has 3 dogs, all with different issues, and I am thinking of making them each a harness or have one fitted. So basically, would it be best to go to a physio to have the dogs assessed, what would be most appropriate for them?
I would think that would be the better solution, if I'm honest. I think because it's not just consider, going back to the lumbosacral disease, if it is not, most of our patients don't just have one problem. They've usually got compensatory issues that we need to address as well. So it's not, unfortunately, one size fits all. So I think if you've got a physiotherapist that you work with, I think it's an initial assessment. Even if it's just a one-off assessment, it would be beneficial, because they will be able to assess their dog's movement, gait pattern, their weaknesses, looking at, what we need to be changing to make this pet more comfortable and maintain its mobility and function, as best we can. And I think once that has been done and we have a clearer picture of what your problems are and how we need to address it, then I think hopefully you can work as a team to discuss what the most appropriate harness is for that pet.
Okay,
Did I answer that okay?
Yeah, absolutely. And then Victoria asked a question. She said, what do you think can be done to educate dog owners about harnesses? And I think it's a bit of a broad question, but I think in terms of for veterinary professionals, so physios, vets, nurses, etc.
Yes, I was talking to you before we went live, Esme, weren't we? We were saying actually that there's not a lot out there about different types of harnesses, and I was researching for this chat this evening, and I couldn't find a lot of information out there. There's not many articles out there that have been published, and so I think we need to do a bit more to educate the public on harnesses and what to consider, and maybe I'll go away after this talk and think about pen to paper. But I think, yeah, if we can start, within the practice, but also, in the community as well. So through, I don't know, dog trainers are probably very good at passing on this information. But also, yeah, if we can also make sure that our vet nurses have a good understanding of what's appropriate, what good and bad harnesses are, or pros and cons of each different harness design, I think that would help as well, especially if you're holding nursing clinics. Yeah, so I think just what was the question again? Sorry, Esme, I don't know whether I answered that well.
Yeah, we're just talking about whether like how we can best educate owners about harnesses and what options are out there. I slightly want to deviate off plan in that I think it'd be great just to quickly touch on talking about the legalities about taking your dog for a walk, because they must be wearing a dog tag with your identification. So although we're talking about these harnesses, there's no reason why they couldn't either have the tag on the harness or wear a collar, as long as they've not got a reason, a medical reason not to wear a collar, but wear one just for that purpose. Is there? No,
that's absolutely fine. Yeah, to my end, that's my understanding anyway, but I might need to check on that.
Yeah.
All right.
Brilliant.
Okay, I think we're on to supports and orthotics. Now, this was touched upon in one of our previous lives with Hannah back in, I think it was February now. But I just wanted to go into a little bit more detail because we touched upon it quite briefly. And this is kind of, I don't know, this is a passion I have. So for those of you that have just met me this way, I did train as a human physio, but a lot of my time was spent as a hand therapist as part of my speciality training. So during that time, I was making splints and soft supports for people with hand problems. And since starting at Davies, I was very fortunate to work with an orthopedic team that were very open to me transferring my skills onto our patients. So I've used them a lot over the years and continue to do so. And currently, last year I started developing a workshop to teach other veterinary physiotherapists the skills as well. So sidetracking slightly, so that's why I have such a big interest in this. So supports and orthotics are an externally applied device used to modify the structural and functional characteristics of the neuromuscular and skeletal system. So it can be used to control, guide, limit, or immobilize a joint. And immobilize means stop it from moving, essentially. It can restrict movement in a given direction. So if we have a ligament problem within a joint and we want to protect that ligament while it heals, we can restrict the movement that it might be vulnerable to because it's been overstretched by just allowing it to move in one plane. So for example, the wrist, for example, if we've strained one of the collateral ligaments, I don't know, I'm imagining that you might be able to see my hand, but if you've strained one of the collateral ligaments, then we need to try and protect that ligament during its healing process. So you want to try and keep the wrist as straight as possible and stopping it from deviating and overstretching it and perhaps limiting its ability to heal fully. Because if it heals in an overstretched position, you're not going to have the joint isn't going to be as stable as it could be. So what we can do is make an articulating device, which allows it to bend and straighten, but protects the ligament that's been compromised and injured during its healing phase. So that's what we do when we restrict movement in a given direction. And it doesn't have to be an articulating device, one with a joint. It can be a device that's immobilizing the joint completely. But yeah, so restrict can mean a couple of things. So it can assist movement in a given direction. It could also reduce load during early rehabilitation. So again, protecting those injured structures. It can be used to aid fracture rehab after cast removal. And it can be used to correct function to provide easy movement capability to reduce pain, which is something we might use for our osteoarthritis patients. So I guess before we go on and talk about the different types, my view is, and I think I was always a bit anxious about recommending knee supports when I was still practicing as a human physio, because I felt that the muscular system should be doing that job for that knee joint. So if we think of the soft tissues and the muscular tissue acting as the biological scaffold for the knee joint, you know, if those muscles and tendons around it are strong enough, you shouldn't require an external coaptation like a support. But I think in hindsight, I think that was probably quite naive, because I feel there is a place for these supports. My reason being that if you apply a support to, for example, let's stick with the knee joint of the human patient. If we suggest a knee support fitted and it makes the knee less painful and the patient feels more comfortable, they're more likely to exercise more effectively because their knee feels better. So if they're exercising more effectively, they're going to recruit the muscles more effectively, and you're potentially going to strengthen those muscles a lot quicker. So you're going to get a better return on your investment by using maybe a light support that makes them feel better whilst doing those exercises. So does that make sense?
Yeah.
Okay. So we have carpal supports. So these are our wrist supports for our pets, and I tend to classify them into 4 categories. So we have our neoprene only supports, and they are, as it describes, neoprene fabric, and they usually are lightweight support, so a bit like a sports wrap, you know, perhaps somebody that's returning from injury, whether they are a family pet or whether they are returning from injury and they're an agility, you know, dog or competition dog. So some people will consider using these because I suppose it makes the pet owner feel a bit more confident that they're giving, you know, additional support for their pet. If it feels a little bit better in the first instance, great, whilst it's going through its early form of training and starting to return to training. But hopefully, ultimately, you'll start to withdraw the need for that support, is where we would like to always get to. Then you've got a neoprene support with reinforcement. And what that means is it's a neoprene support which we can add further elements to that, whether it be additional neoprene straps, or what I tend to do is use Velcro. So I would use hook and loop Velcro back to back, and I would stick my Velcro down the outside or the inside of the joint or across the back of the support, and that'll give it a little bit more structure while still allowing the dog to still bend and straighten the joint a little bit. So it's kind of a stage up from your neoprene only and a stage down from the next one we're going to talk about. So the next one is your neoprene liner, which is what we've just discussed, with a thermoplastic shell. So the thermoplastic component is plastic that can be softened down at a temperature and molded to your pet's limb. So it's bespoke, which means that the fit is going to be as good as it can be for your pet. But what these splints do is that it immobilizes the joint. So it stops the dog from moving its joint in any direction. They can be made into splints that have got hinges, but that's something that we're still working on and not common in the animal industry at the moment. But there are some very good hand therapists in the human field that are making hinged splints all of the time. So hand therapists are occupational therapists and physiotherapists, and I worked in a team of both. And saw them, a lot of my colleagues make those type of splints up. But largely in the small animal industry, they're usually non-articulating ones, so ones that don't allow the joint to bend and straighten. Now, I guess when you start getting to supports like this, where they're rigid, they do come with their risks, and they can cause sores, especially because our pets can't tell us when there's a bit of a pressure point and it feels a bit sore, or it feels, it's a bit tight in that place, and when I place my foot down to the ground every time, it feels a bit sore. So they do come with their risks, and I am very strict with my pet owners, and I'm quite firm and say you need to inspect the limb regularly. We keep walks to an absolute minimum to start off with, so we can monitor for any loss of hair or any signs of redness occurring and rubbing, because we don't want to develop it into a sore and an open wound, essentially. So there are risks associated with those types. And the same with the last one as well, the bespoke orthotic. So whilst these are both bespokely made and they're as close a fit or as good a fit as we can get for our pets, there are some risks. It's like you going into a new pair of shoes and your foot's not used to it. It's going to take time to adapt, and you're going to get potentially some sores. And okay, our skin hardens up a little bit over time, but if you're slightly if it's incorrectly fitted, or by potentially the pet owner, or it's been poorly made, for example, then there are those risks, and we need to make sure that we address them as soon as they are noted. Okay, so the orthotic on the right is one that we need to cast the patient's limb. So we would get your pet into the clinic, we would take a limb impression, and then that limb impression goes overseas, because there's no one in the UK that does this. So it goes overseas to a company, and they take that limb impression, they create a plaster of Paris impression of your dog's leg, and then they will create the orthotic. And usually it's an orthotic that is made based on feedback from the vet or the therapist on the design that they want, depending on the underlying pathology. And then you get that orthotic returned to you, and then it's your responsibility to fit it and oversee the follow-up as well with that orthotic. And I'm usually very close to my patients when those are fitted initially. Okay, so
it's absolutely fascinating, isn't it? And I think the more you move towards the right, I guess the more important it is that you have a professional there for advice. So as an owner, you probably, even from just the neoprene, need to know why you're using it and when to use it, and to use it in the correct scenario. So I guess that's just making sure you've got that support there in terms of somebody who knows what they're doing and can check that it fits properly, and that it's actually doing beneficial things for your pet. Laura's just said, do the neoprene supports, do they offer a proprioceptive benefit too?
Yes, they do. Absolutely. A very good point, that, because you've got that pressure, that gentle pressure around the limb as well. So absolutely can be used for that, from whether it's a musculoskeletal issue that you're trying to improve proprioception with, or whether it's a neurological problem. Yeah.
Brilliant.
Okay. So yes, this is just an example of the orthotic. So this is Tess, who has been, she's been coming to our clinic maybe for over 3 years. She's part of the furniture, and she's one of our more complex cases, osteoarthritis cases. So Tess initially came to us with quite advanced elbow osteoarthritis in the right forelimb. She's got a lot of extensive bony remodeling in that right elbow, and it's very thickened when you feel the elbow joints. But because it's so advanced in the right forelimb, she's been loading her left forelimb quite heavily over the years. And I think it's been about 18 months ago, 20 months ago, she started showing signs of carpal collapse in the left forelimb. So because she was loading the left to try and offload the pain in the right elbow, she was placing so much strain on the structures down the back of the leg that you can start to see the extension. So the picture on your left is her left forelimb, and the picture on her right is actually her right forelimb, which is the one that's got the elbow osteoarthritis in. And these pictures were taken quite a while ago. So obviously we want to try and protect that left wrist as much as we can to stop it from collapsing further, because she's she's consistently quite lame in the right forelimb, and we're managing her pain very well, but she's also got quite a large degree of mechanical lameness because of the extensive bony remodeling that's taken place in the right. So what we did, we passed Tess up for an orthotic, and she has a carpal hyperextension orthotic. So it means that it allows her to bend and straighten her wrist, but it's got a stopper strap. So in the picture on the right, the far right, with the orthotic fitted, there's a strap that runs down the back of her wrist, which stops her from collapsing deeper into extension. So it protects it as she continues to enjoy her short walks that she still enjoys with her dad and her mum. So yeah, so that's Tess, and she comes regularly to us for combination of acupuncture and manual therapy and laser, and also underwater treadmill therapy as well. But she not only has forelimb problems, she also has a suspected partial cruciate in her left hind limb. We're worried that the right one is compromised as well, and she also has some signs of polyneuropathy. So she's showing some neurological problems in the hind limb. So she's very complex, but she's a fabulous patient. She's quite entertaining, actually. She'll walk into our centre, and if the room is open to the gym, she knows exactly where she's meant to be, and there's a vet bed usually on the floor, and she'll walk straight into the gym and just lie there, and it's like, okay, it's my spa day. Where are the needles? So she's brilliant, and the most laid-back dog I will ever meet. So that's Tess. I should have got a picture of her. I'm sorry. So yeah, just quickly touching upon tarsal supports or orthotics. I should have made a point at the beginning, apologies, but when I talk about supports, orthoses is a global term for anything, any supportive device, so whether it be soft or a harder device. So I usually classify them as orthoses. So yeah, so which is what that term means. And an orthotic means the actual device itself. But again, you have your neoprene only, then you've got your neoprene with reinforcement. Then you can see one of the bisurface slot through splints that I make, which is reinforced with roll bars on the outside, you can see. And again, that immobilizes the joint. And then you have the bespoke orthotic, which is purchased overseas, is actually an articulating device there. So this dog had a ligament injury on the inside of her ankle, so we needed to protect it whilst it healed. But so this orthotic allowed this patient to still bend and straighten the joint, but not allow it to collapse into the inside of her, which would overstretch the inside ligament structure. So yeah. Those are the tarsal ones. Then we have elbow. There are elbow orthoses. So you've got softer ones, which are the first two images. And again, some of our elbow osteoarthritis patients or pets, they do get hygromas in the elbow. Their skin becomes very vulnerable on the olecranon and over the bonier structures of their elbow. And so some pet owners find that they need some level of protection, so these can offer some protection. And the image in the middle shows this also being used as a shoulder stabilization system with a strap across the chest, and I think you can just about make out they have the hobble strap as well, but you can use the same device without the hobble strap essentially. Allowing them to still move around. And then the orthotic on the right is an articulating elbow orthotic to prevent any deviation in the elbow, and that was a complex case that had a total elbow replacement many years ago, which unfortunately had failed. So they put an external fixator on. It hadn't failed in that it sort of as a unit itself, but basically the dog itself, she started to show signs of deviation in the elbow joint. So we call it, if I recall correctly, she was going into what we call varus, which means that the forelimb was going inward and placing stress on the outside structures of the joint. So they tried to fix it for a few weeks to try and get scar tissue to tighten up the elbow joint. But unfortunately, as soon as that fixation was removed, the external fixation, she just went back into the same position again. So this was a long-term solution try and manage it going forward, to try and stabilize the elbow joint. So this orthotic allowed flexion extension of the joint whilst keeping it in the right plane of movement, so essentially going forwards and backwards. Okay. Any questions so far?
No, it's all really great.
Okay, so this is a stifle orthotic. You can get soft ones. I have to say I've never recommended one or used one. Could have a proprioceptive benefit, but I from a point of view of stabilizing the joint, if you've got a pet that has cranial cruciate disease, then I wouldn't, I've never used them. So and don't feel that they would do the job that I would require it for. So there are orthotics with the more durable thermoplastic materials, and this is one that I do quite like the design of. There are other designs as well, and like I said, work with the therapist if you are considering this, and I'm always happy to advise as well. But the essentially, I think Karen Perry was talking about this a few weeks ago, cranial cruciate disease, but for those of you that aren't familiar with it, essentially it means that it's a bit like an ACL rupture that we see in a lot of our football players or skiers. And what we get is rupture of the cruciate ligament, which attaches from the back portion of the thigh bone and attaches to the front portion of the shin bone in us, and the same in the dog as well. And basically, without that attached, we get this shearing motion. So the shin bone or the tibia is gliding forwards. So as the foot comes to the ground, you're going to get this excess gliding motion occurring if the ligament has failed or has been compromised. And that shearing motion is going to continuously cause wear to the joint itself and the articular surfaces of the joint. So what we wanted to try and do, and this is for any dogs that aren't undergoing surgery, because hopefully surgery is going to rectify these biomechanical issues arising from this, we consider an orthotic. And I guess the cohort of people that might consider this as an option are those that are worried about surgery because of other health problems in their pet, financial problems, although these do come at a little cost, so worth considering everything. Yeah, and just general fear of surgery for their pets, even if there isn't any other comorbidities or age-related issues or other medical reasons for undergoing anaesthetic. So yes, basically this orthotic is designed to prevent or limit that shearing motion that occurs in the joint. And you can see the red arrows are where the plastic components are, and basically the image on the left shows the direction that the shin bone or tibia wants to glide in, and then the arrows on the orthotic itself are designed to show you the corrective forces that you're trying to achieve through use of an orthotic. So basically, if you've got an orthotic with those directional forces, you're trying to limit that shearing motion occurring at the stifle or the knee joint. Okay, so yeah. Does that sound okay?
Thank you.
Right, so coming to the conclusion, I'm sorry, I don't know what the time is, so apologies if this is longer than people are expecting.
Yeah, brilliant.
So there's different types of boots, and we did touch upon this last time, but I just thought I'd put some pictures up here because it's so easy for me to describe them verbally, but unless you see it, it's very difficult otherwise. So there's different boots. So there's the first one has a nice gel lining in the sole, so great for any dogs with digital osteoarthritis. Again, these can be modified as well. So, you know, there is a colleague, a veterinary physio colleague, physio colleague who works and on adjusting these boots for patients. I don't mind saying they are Therapore boots, and so if you've got a dog that has got unusually shaped feet and you feel it needs to be modified, then that is one that can be certainly adjusted according to your pet's breed or, you know, or foot posture. Then you've got another one which is a good robust design as well. I particularly like using these because I also look at adjusting the inside if I need to on some feet with that I see, some feet I see. Some pets paws. So if they've got digits that are have got osteoarthritis, or they've got deviation of the digits because of osteoarthritis or other issues, then I like this boot because I can place an insert to correct that foot posture further, a bit like we would have insoles in our own shoes to correct our foot posture. And then the furthest on the right is what we call an orthotic, a grade 4 orthotic, not too dissimilar to the ones that you saw earlier for the carpus and tarsus, or wrist and ankle. And again, this is a dog that had a toe amputation and had quite a lot of deviation. And what I've done there is just to put a little wedge in between the toes to stop that toe from deviating. This is a dog whose owner had done everything under the sun to try and improve his pet's comfort. He tried every boot, he tried modifying every boot. And so this was, I think, probably something he hadn't tried, and he was prepared to do this to see whether this was going to be the best option going long term. And so yes, so that's what we did for him, and he got on very well with that. So and then, so as I was saying, you can modify these boots, and even if it's just taking pieces of material out like the Therapore boots to try and improve the fit overall, particularly nice because they have the gel cushioning, as I said. But for the other boot, I tend to place an insert in, and I place, I build up a wedge. So I look at the foot posture, which you can see the image on the right, and those digits are deviating inwardly, so medially. So what I've done there, we need to try and lift the outside of that foot to try and improve the alignment of those digits. So you can see on the image on the right where I've placed my little wedge, I created a similar wedge that's, that I've drawn on that slide and placed it in the inside of the boot. And so when you are purchasing boots, if you are going to have an insert placed inside it whilst working with your therapist, then make sure you take that into account when you're purchasing the right size, because you might need to take the next size up. So one thing to consider. All right. And then finally, there are anti-slip products in the market. I know that we talk about rugs and runners for our osteoarthritis patients, but I just thought, as we were talking about assistive devices and other things that can help our pets, these are sort of, I suppose, grouped into categories. You've got like a latex balloon type device, which will give extra traction. We've got the little socks that you can improve traction with, and then you've got the paw friction on the right, which is medical grade glue with that grainy substance that adheres to your pet's pads to try and improve traction on the floor as well. So those are other things that we can do to help or recommend to help our pets. So yes, that comes to the conclusion. So I'm going to try and see if I can come back to you, Esme. This is when I'll see all the questions, isn't it? And I'll be...
Yeah. I can just that one. There we go.
Back. Ooh, stop sharing. Am I back?
Yeah, that's it. Perfect. So we've had some good questions. So in terms of orthotics, what advice would you give owners? Because there's a lot of off-the-shelf orthotics that they can just get hold of. Is that something you would recommend doing, or do you think that's something we need to get a vet or a physio on board?
I personally would get a therapist on board to advise you on that, because they can help you measure up. They'll hopefully be able to, because we know the anatomy better, they'll know where the measurements need to be exactly taken place. And so I would talk to your vet or your therapist about what you should be buying for your dog.
In terms of like anti-slip devices, so the last ones you just talked about, is that something as well, or do you think that's something you'd maybe be a bit more prepared for them to have a go with?
Yeah, I think that is absolutely fine. They're less bespoke. I think the risks associated with using those devices are much lower. And so I think, those anti-slip devices, those little latex balloon type devices that go over the feet, they do ask you to measure them up appropriately. So what you normally do, you place your pet's foot onto a piece of paper and you draw around the foot. And then I normally draw a ruler either side at the widest point and measure the width across. And then you will, actually that's for one of the boots I've just described that for, not the latex balloons, but I don't think it's too dissimilar. Or they do
sizing. Yeah,
definitely get approximate sizing, but they do have breeds on those latex balloon products. They do have the breeds next to the sizings. So although we know that even within breeds, they're all different shapes and sizes.
And sometimes funny with the front and the back feet as well, because I've seen dogs which have actually quite different size feet from the front to the back. So it's important to take into account if you're planning on using something on all feet, just to make sure you know what size feet they've got. Someone's asked, can orthotics correcting alignment in, for example, the foot or ankle, help reduce the wear and tear on other joints?
I would say yes, because if you imagine the impact of, if you've got osteoarthritis in your foot, I can describe it like, I don't know, I feel I'm getting some osteoarthritis in my thumb, and because of that, I'm modifying the way I do things, in and around the house, like opening a jar. I'm opening it in a different way now because I can feel it, and it's becoming more automatic. And so I think when you've got osteoarthritis in one joint, you do everything you can to take the pain away or avoid the pain, and you'll modify the way you're positioning the other joints. And is that going to leave them more vulnerable to issues further down the line? So I guess if you're correcting the primary problem and making them more comfortable there, hopefully they're going to continue to use the other joints as they should be, and not compensating because they're trying to avoid pain in the primary problem. I think
not from the joint perspective, but maybe from a muscular perspective, you might have where you're going to better use. So yeah,
absolutely, because many therapists will, if you've got a therapist already, they'll be identifying trigger points, myofascial tightness, elsewhere in the body. And that's, owners will probably look at me a bit puzzled in the first instance when I assess their patient, because I do a full head to tail examination. They might have knee osteoarthritis or hip osteoarthritis, but I start at the head end and I work right the way down to the tail. And I do explain to the owners why I'm doing that, and they totally understand, because I can see the initial puzzled expression on their face.
Cool. So we'll just take one more question, and then I am going to ask you to do 10 top tips if possible. Okay. Emily, who is an RVN, has asked, how do you get on one of your CPD days on orthosis?
There's no more planned at the moment. We did have one planned for the it was a pre-symposium workshop for the International Association of Vet Rehab and Physical Therapy, which was due to be held in Cambridge in August. But we've postponed that until August 2021. So I will be delivering, that's the next one planned at the moment, but there may be further opportunities before then if the demand is there. So yeah.
Watch this space, basically. Yeah, perfect. So would you mind doing us your 10 top tips for arthritic pets?
Okay. I have to say then, as I said to you before, Esme, they're not related to what we've talked about necessarily, but also some of them are related to what we've talked about this evening. So they will be touching upon other people's top 10 as well. I don't think there's any way of avoiding any overlap, so apologies. But hopefully it's sending the message home and no, well, we're all singing from the same hymn sheet essentially. So more rugs, less drugs. I love that saying from Cam. So if there's one thing that you can do at home, try and address the flooring issues to try and protect your pet's joints. And if it's unavoidable, being able to address the flooring, then look at those anti-slip products as an alternative, but that should be a last resort. Hopefully, try and look at the flooring first and foremost for your pets.
Yeah.
Okay. Number 2, we talked about the anti-slip device, the paw friction.
Yeah.
But another big thing that you can do is trim the hair between your dog's toes. If you've got a long coated dog, make sure you keep that hair short and trim the toenails as well, just so your dog's got the best chance possible of having maximum grip on any slick surfaces. So really important, that can make a big difference too. Number 3. So it's very easy at the moment. Most of us are at home working from home. We're around our dogs more perhaps than what we're used to. We're only allowed to exercise once daily, according to the government guidelines, although that may change on Sunday. Let's watch this space. But don't over-exercise your pet, particularly if they've got osteoarthritis. It's very tempting to do so because you're trying to maximize your time out the house. You think that actually your dog's not getting 3 times a day like it was previously, so we're just going to do one longer walk. But their dogs, you know, their bodies aren't conditioned for that, and that's going to cause obvious problems as well. So because you're overloading those joints, and they're going to be very stiff and sore. So we've got lots of owners that have been contacting us saying, you know, they're not coping during this lockdown period, not seeing you, they're sore, and you start questioning them, and then, you know, you find out this information. So really important to take that on board.
Yeah, absolutely.
What you can do, number 4, is replace those other 2 walks with brain games to keep your pet moving in and around the home. So that can consist of, you know, get empty toilet rolls, and if your dog's not going to completely devour it or eat the waste rubbish, get your recycling, be inventive, try and hide some treats inside, you know, screwed up, you know, newspaper, inside a toilet roll, get them, you know, hunting things out, scatter food around the house and the garden, snuffle mats at feed time, enrich those feed times with snuffle mats. So, you know, keep your pet active. They do not like long periods of inactivity, these osteoarthritis pets. So please try and do your utmost to try and, you know, encourage them to move little and often.
I've seen some fantastic videos of people making out of a cardboard box little holes and using a carrot to play like whack-a-mole, and the dog's trying to grab it as they move the carrot around. And it's fantastic. There's some really inventive ways out, you know, to keep them entertained.
That's great. And I you know, I was talking to a colleague yesterday, and she said her dog has learned so many new tricks since being off. You know, teach your dog new tricks as long as it's within, you know, if you're not certain about certain tricks and you've got a therapist that you work with, check them first. But, you know, use this opportunity. You know, it's great for their mental stimulation. So
absolutely.
So yes, number 5. Laurie also mentioned this a few weeks ago, but make sure you seek assistance from a therapist early. They will help you identify any issues when they arise very early on. They'll also help you to educate you and teach you how to become familiar with your pet and understand your pet, and you will know or learn to know what's normal for your pet, even if they've not been diagnosed with osteoarthritis. It's a good idea to get somebody on board early, even if you're only seeing them once every 6 months. But if you've got somebody on board early that can assess your pet, get a baseline, educate you, allow you know, teach you how to feel joints and you know, do some activities with your pet, then you'll learn to know what's normal for your pet. So if you're feeling that things are going outside of the normal, then you can say to your therapist, something's not as it was, can I have you check on that? Yeah. As therapists, we also pick up things quite early as well. So, you know, we have a lot of cases where they've been referred to us with one problem and never had a workup with another problem, but they have clinical signs of arthritis in one of the joints, or, you know, I see quite a lot of toe osteoarthritis, and the owners haven't really picked up on it, but there's significant restriction in movement. And so I can identify that. I can tell the owner what I've found, and I said, we need to monitor that going forward, and you need to consider what your day-to-day activities are as well. So we can pick up on things that haven't really reared their head, and they haven't shown any clinical signs of lameness related to that, but we're seeing, you know, some mechanical, you know, biomechanical changes that might suggest there could be a problem further down the line. So it's just, you know, and making people aware.
That is true. Generally, the cases we see that are diagnosed with arthritis are the ones that are already painful, which means it's already quite far down the disease process. So absolutely, if you get into a you know, good relationship with the therapist early, hopefully those little minute signs can be spotted.
So yeah, so that was number 5. Number 6, don't underestimate the value of a remote consultation. So a lot of therapists are still offering remote consultations at the moment, even if they haven't been able to come and see your pet face to face. So I have managed to assess patients remotely and seen such improvements by educating the owner through the power of technology. I've got my stuffed dog. I demonstrate exercises. If it's not through Watson, then it's through my stuffed dog. I get them to demonstrate tests back to me as long as they're happy and I feel they're safe to do so. But that you can still get a lot of value from a remote consultation with your pet. And we're doing video consultations, which allows us to assess their pet's gait. And we can see other things that we ask them to repeat back to us as well. So consider that whilst we're in this period of change. And who knows, it could be a thing for the future as well. So if they go well. Number 7, medication. So I think a lot of pet owners are a bit nervous about their pets on medication long term. And my view is that it's really important to keep them on medication even when you restart or when you start rehabilitation or other therapies, because particularly when it comes to the hydrotherapy or targeted exercises we might give you for your pet, if the pet is more comfortable, and it goes back to what we were talking about with the support, if the pet's more comfortable, they're going to exercise more effectively and you're going to get a better outcome because you're getting a better return on investment. So it doesn't mean that they can't withdraw from it long term, but it's really important they're on it in the beginning and you work with your vet and therapist to decide when it's the right time to slowly, reduce the dose if it's appropriate for your pet. But don't just stop the medication because it's really important. If you're undergoing physical therapy and exercise therapy without medication and your dog's sore, then it's not going to be as effective. So maximize the effectiveness of your therapy sessions. All right. Number 8, targeted exercise program. So work with your therapist, come up with a targeted program for your pet so you can improve the strength and stability of the affected joints appropriately. So really important. Just, it's very easy to Google exercises for your arthritic pet, but it might not be appropriate for your own individual dog. So do consult somebody first before taking on anything. Okay. 9, weight loss. Really important. If there's one big thing you could do to help your osteoarthritis pet is keep that diet, in consideration. So we're all at home more at the moment. Our pets are around us a lot more. We've got our hands in the treat bowl a lot more because we're wanting to please our pets. And then the waistline is expanding. So let's remember that. And if you're using treats for the exercises, keep them healthy or take a portion out of their normal daily allowance. So make sure that you factor that in.
Yeah.
Okay. And then finally, it really is reflecting back to getting to know your pet. So work with your therapist, get to know your own pet and recognize those changes before they become a bigger problem.
Yeah. Brilliant.
I think that's it.
Thank you so much for your time. I'm sure everybody who's been watching has thoroughly enjoyed it, and this will be available again on YouTube once we've uploaded it as well. So yeah, it's been really informative. I've absolutely loved it. I feel like I've learned loads, and I think I can take that forward with my own patients. So I'm very grateful to you for your time. Thank you, Diane.
Thank you for inviting me back.
Take care. Thank you, everybody. Good night.
Bye, Camp followers.